my name is Bernard Siegel. I'm the Executive Director of the Regenerative Medicine Foundation and founder of the World Stem Cell Summit. Welcome to the annual Regenerative Medicine Foundation Stem Cell and Regenerative Medicine Action Awards at the World Stem Cell Summit. We've been doing this since 2005. At this awards ceremony, we will be honoring some of the leaders of our field, those that have made an impact and taken action to change the course of the future of medicine. Our organization, the Regenerative Medicine Foundation, is patient advocacy driven. I myself am a patient advocacy and came to this field as a cancer survivor, hoping that biomedical science would advance to a point where it would be able to not only treat effectively, but cure some of the scourges that humankind face. Our mission is to accelerate regenerative medicine, to improve health and deliver cures. We're now a membership organization. And if you're interested in joining us in this fight, I welcome you to visit regmedfoundation.org. Now, what does the Regenerative Medicine Foundation do? One thing that we work on, and we've done it since 2003, is work on policy to accelerate the field. And what that means today is a diversity of subjects, including workforce development for the manufacture of cell and tissue-based products, where our organization works with the National Science Foundation. We do congressional briefings with our partner, the Alliance for Cell Therapy Now. I'm very pleased to serve as co-chair of the advisory board of that consortium of organizations, largely academic centers that are engaged in clinical trials using stem cells. We also support freedom for scientific research within ethical boundaries. We support the Food and Drug Administration and its enforcement against those that they call bad actors and snake oil salesmen, but also to improve education and to move this field forward as quickly as possible within the boundaries of efficacy and safety. We work in the United Nations, sometimes in the courtroom where we have filed Friends of Court briefs to support the NIH for its ethical guidelines to advance embryonic stem cell research. We've worked tirelessly to help organize patients and patient advocates, because we can remember what Lincoln said, with public appreciation, you can do anything. Without it, nothing can be done. In addition, we work in the field of education. In education, we have created STEM and STEAM projects for cell therapies and cells and cell biology for school-age children and after-school care. We have worked with our friends at Wake Forest Institute for Regenerative Medicine in their wonderful Regenerative Medicine Essentials course, which you have enjoyed this week as a combined meeting with this virtual World Stem Cell Summit. We have a partnership with one of the most preeminent scientific journals in our field, Stem Cells Translational Medicine. Editor-in-Chief, Dr. Anthony Atala, and published by AlphaMed Press under the leadership of our friend, Dr. Ann Murphy. In addition, we know the importance of communications through social media, participation in coalitions. We try to unify the world to support this new area of research and translational medicine, where before we were only looking at drugs, biologics, and medical devices. Now we're in the world of cell therapies. It's a field that could be curative. We have two special messages from preeminent patient advocates. One is Sabrina Cohen. Next is Brooke Ellison. Both of them were honored by the Regenerative Medicine Foundation with Stem Cell Action Awards for inspiration.
Hi, my name is Sabrina Cohen. I'm the president and founder of the Sabrina Cohen Foundation, also a C3 quadriplegic living with a spinal cord injury for nearly 30 years. I worked many, many years with Bernie Siegel, and I became a stem cell research advocate who traveled all over the country meeting the scientists and the patient advocates. And it was a very personal journey for me as well. What stem cell research and the movement meant to me on a very personal level, as well as what it meant to me as an advocate to help other people and to share and deliver that message of hope to thousands of people around the country. So when it comes to thinking about the importance of advocacy, it really is something internal that you feel. And for me as an advocate, what I find most inspiring and exciting about being an advocate is that, number one, I had to learn from my own experiences that took many years to come and step into, like, this place of confidence where I could then be a voice for others. And then as a voice, as you get older and more mature as an advocate, you realize that your message helps inspire people living with similar conditions or any life-altering condition, or even living a regular life. You can inspire. And I'm particularly, as an advocate, very grateful for the fact that I can help mold and shape children that might be living with different challenges and inspire them to grow up and be confident and vital members of society. So I think all in all, advocacy as a whole really is everything, because if people going through their own conditions or challenges don't speak up, nothing gets done. So everything begins with education and believing in what your cause is, and then inspiring change, and that's how it happens. So to me, advocacy is everything. Since being a stem cell research advocate and receiving the award, my career continued to move forward on supporting the cause. At the same time, what I learned from a lot of my advocacy work was that while we're waiting for treatments, there's a huge gap in quality of life initiatives. So over the last few years, my foundation has opened the doors to providing more fitness and outdoor recreation activities to people with all types of different disabilities to keep them as healthy and active as possible. And right now I'm working on a huge initiative to build our nation's first of a kind adaptive recreation and fitness center in Miami Beach, Florida. So that way we can welcome people from all over South Florida, as well as all over the world, to keep them as active and healthy as possible. So that way when treatments do become available, their bodies and their minds are in the best shape possible to receive treatments.
Hello, everyone. First, thank you, Bernie, for this invitation to share my thoughts with all of you today. My name is Brooke Ellison, and it was 13 years ago that I received the Inspiration Award at the 2008 World Stem Cell Summit. And I received this award for my advocacy and activism in this field. Advocacy and activism that I took on really for no other reason than to champion and pave the way for a field of science that I saw and continue to see as a very mechanism of hope and opportunity for so many, myself included. I fought and continue to fight for this research because I know that it's right, and I know that it's powerful, and I know that it has the potential to revolutionize not only medicine, but people's lives in a way that we never really fully experienced before. Stem cell research and its advancement are causes that I've chosen to dedicate my life to lend my voice to the pursuit of cures and treatment for the very diseases and conditions that have ravaged humanity for so long. 2008, 13 years ago, was quite some time ago for sure. And in these 13 years, I've built my academic, avocational, and professional careers around the advancement of stem cell science and regenerative medicine. Concurrent with my 2008 award, I created a nonprofit organization, the Brooke Ellison Project, designed to provide education to people from all backgrounds about the stem cell research, to alleviate concerns and change misunderstandings. And through this work, I produced a documentary called Hope Deferred, which interwove the fundamentals of the science into a series of stories about the lives of people who might benefit from this work. And I've been fortunate to work on the public policy surrounding the science when I served on the ethics committee of the Empire State Stem Cell Board, helping to create one of the most progressive and science-friendly regulatory environments in the world within which this research can advance. And the benefits of this policy have been nearly immeasurable, with breakthroughs happening here in New York at times when they were needed the most. I served as the Director of Education and Ethics of the Stony Brook University Stem Cell Facility after having gotten my PhD from Stony Brook in the sociology of science and science ethics, and writing my PhD dissertation on the societal influences on stem cell policy in countries all around the world. Helping to advance this science and helping to mitigate obstacles that might be in its path was my goal itself. I never needed anything more than seeing the promise of this research come to fruition, and in so doing, the manifestation of hope for so many. Yet my involvement in this field has generated attention above that in ways that I never would have anticipated or even would have wanted. In 2011, I was presented with an honorary degree from Rutgers University for my work in this field. In 2014, I was chosen by the World Economic Forum to serve as a young global leader for my work. And this was followed by my selection as a national finalist for a White House fellowship and ultimate selection as a Truman National Security Project political partner as a result of my involvement in the policy creation needed to support this work. And most recently, just last year, I was awarded the Stem Cell Hero Award from the New York Stem Cell Foundation. And these were outcomes, and significant ones at that, but entirely separate from what brought me into the field to begin with. It was the hope in this field that was my motivator. It was the faces of people who could benefit from it that was my motivator. It was the promise of a stronger and brighter future that was my motivator. 2008, 13 years ago, was quite some time ago, yes. But in many ways, the climate we're in right now and the challenges we're facing as a global community is very reminiscent of 2008, as well as the preceding years that drove my involvement into science advocacy. Much like what we experienced in the early 2000s, right now, we as a country and as a world are facing a frightening intersection of a tremendous need for science and science advancement, as well as a skepticism over the veracity and significance of science. Over these past few years, the authority and expertise that we have traditionally ascribed to science has been eroded, despite the fact that it's through the vision and pursuit of science that we've begun to reemerge from the biggest public health crisis in over 100 years. And that divide, that gap between the need for science and the value that we ascribe to it, is where advocacy lies. That was the bridge that I hoped to create in 2008, and that's the bridge that we need right now. And that takes all of us. That takes every one of us who cares about science to speak on behalf of its importance, its value, its immeasurable role in our lives. The recipients of this year's awards are the embodiment of that, and we all need to follow their leadership. I've always considered it to be an honor to be involved in the advancement of science in general, and in this field in particular. And it's just as big an honor to fight alongside all of you. So congratulations to all of this year's honorees, and thank you for reminding us all that we all have a role to play in helping to shape the future. Enjoy the rest of the summit, everyone.
It's my great pleasure to introduce Mr. Sam Merchant, the chairman of the board of directors of the Regenerative Medicine Foundation. Mr. Merchant is the founder of the Merchants Financial Group, a privately held capital investment company founded in 1986 and headquartered in Atlanta. It focuses on identifying and developing international growth opportunities in multiple business sectors, including healthcare, biotech, banking, commercial real estate, manufacturing, franchising, and underwriting of traditional and alternative financial products. Sam is the chairman of his family's capital trust and fund, a position he has successfully served since 1982. But the Sam merchant that I know is passionate and a patient advocate. He is truly a global international man. The merchant family has enterprises and successful businesses all over the world, in Africa, Asia, Europe, North America, South America, Australia. Other than Antarctica, he's got it all covered. And the value to having Sam as the chairman of the board is he brings something in the vernacular known as Siegel. It's a business sense. And if we are going to accomplish all the things that need to be done with regenerative medicine, we have to understand supply chain. We have to understand cross-border cooperation and collaborations. Sam is bringing all of that to the table in support of the field of regenerative medicine.
Welcome, honored friends, colleagues, and special guests. It is my great privilege to stand here before you tonight as the chairman of the Regenerative Medicine Foundation, the founding organizers of the annual World Stem Cell Summit and the annual Stem Cell and Regenerative Medicine Action Awards. Our foundation is also a proud partner with the Wake Forest Institute of Regenerative Medicine, Dr. Tony and Atala, and Joanne Shank in the Regenerative Medicine Essential course, and with the journal Stem Cells Translational Medicine. The journey began 19 years ago. My good friend Bernie Siegel had the pioneering vision of bringing together all facets of the stem cell and regenerative medicine community in a World Stem Cell Summit geared to expand knowledge, forge collaborations, and deliver cures. As Bernie always says, it's been a journey and a half. We honor his vision and his stamina. Since 2003, the Regenerative Medicine Foundation, formerly known as Genetics Policy Institute, has built the strongest, most comprehensive, and trusted network of stakeholders. At this time, while the world struggles with the terrible pandemic, our mission is more important than ever to accelerate regenerative medicine to improve health and deliver cures. We are committed to the ethical advancement of innovative medical treatments powered by regenerative, restorative, and curative technologies. All we do is in service of health, life, and alleviation of human suffering. I am now very pleased, and I must say, honored to salute the 2021 Stem Cell and Regenerative Medicine Action Award honorees. For Advocacy, the NFL Alumni Health. For Pathfinding Research, Dr. Feng Zhang. For Education, the Global Immunization Action Network, Giant. For Leadership and Advocacy, the Klein family, Bob, Danielle, and Rob. For Lifetime Achievement, Dr. Joseph P. Vacanti. I extend a special thank you to all my fellow members of the board of the Regenerative Medicine Foundation, in whose name these honors are bestowed. My vice chair, Dr. Jeannie Fontana, Dr. Anthony Atala, Dr. William Futrell, Dr. Ann Murphy, Dr. Sam Milstein, Dr. Steve Davis, Connie Harrell, Rick Bloom, Rick Grosberg, Pete Ludwig, and Alan Giacomo. Last but not least, Bernie Siegel. Bernie, you have recognized the importance of bringing people together, opening doors, and clearing the path for life-saving discoveries, continuing the very mission which together we all must support. It is with much gratitude to Bernie for maintaining these important partnerships and ensuring that the dialogue continues both behind the scenes as well as in the boardrooms, the classrooms, in Congress, the United Nations, and most importantly, in this day and age on Zoom. It's a special leadership that invites innovation and lays the fertile ground for success. I must mention that personally, it continues to be an honor to serve the very prestigious patient advocacy organization, Regenerative Medicine Foundation, alongside with Bernie and the most accomplished RMF board for the last 2 years. And it is a pleasure to share this wonderful evening with all of you. Thank you.
I want to thank the wonderful team that produced the Regenerative Medicine Essentials course. My co-chairs of that course, Dr. Anthony Atala of the Wake Forest Institute for Regenerative Medicine, and Joan Shank. Thanks to you both, and also thank the wonderful and hardworking team of the Regenerative Medicine Foundation. 2020 was an impossible year, a year of great loss. And the Regenerative Medicine Foundation lost two of our heroes and supporters. One was Professor Dr. John Gearhart, the developmental geneticist, professor, stem cell researcher, and one of the founding members of the Science Advisory Board of the Genetics Policy Institute Regenerative Medicine Foundation. His contributions to the field were incredibly important. He sat with me hours when I was beginning the advocacy work and explained to me all that I needed to know about the peer-reviewed process. As a layperson, it was quite an education. Also, we remember our friend and colleague, Dr. William Bill Brinkley of Baylor College of Medicine, an astonishing leader in the field who served as president of many societies in the field, the American Society for Cell Biology, the American Society for Biochemistry and Molecular Biology, and others. Both Bill Brinkley and John Gearhart were with me when we did our first UN conference all the way back in 2004. Bill Brinkley was the hero and received the Hero Award from the Regenerative Medicine Foundation in San Antonio as part of the World Stem Cell Summit. He also served on the board of directors of our organization. We will miss them both. We're going to start the presentation ceremony with the Advocacy Award. The Advocacy Award goes this year to NFL Alumni Health. I've had the pleasure for the past year of working with the National Football League Alumni Association that has created NFL Alumni Health. And as part of their efforts, the NFL has launched a program to educate its membership and the public about the potential benefits of regenerative medicine and cell-based therapies, and the questions patients should be asking as they seek out safe and effective approved treatments. We can't thank the NFL Alumni Association enough, because when we think about the role of sports and professional sports around the globe and understand the professional athletes, indeed all people that participate in athletic competitions, run the risk of injuries, in some cases traumatic brain injury or a sprained pinky. Well, what are they doing for treatments? Will the treatments that they receive, will they be safe? Will they be effective? Are the patients going to be ripped off? And as a community, the NFL alumni is a robust community. The association welcomes not only former players, but coaches, cheerleaders, and others. These communities represent a vulnerable part of our population. And the gridiron champions that we know have compelling patient narratives. And as I said earlier, narratives can drive the field forward and accelerate the field. This year at our World Stem Cell Summit, the NFL Alumni Health provided two wonderful presentations. One with leading physicians and scientists, regenerative medicine for professional athletes, and NFL stories, gridiron champions, and their unmet medical needs. So now I present to you NFL Alumni Health.
Thank you for bestowing this prestigious award to NFL Alumni and NFL Alumni Health for our work around regenerative medicine and cell therapies. This is a great honor. Our members suffer a number of conditions as a result of playing in the game. Our members suffer from arthritis, joint pain, especially in the knee and hip, cognitive impairment, and neurodegenerative disease, and chronic pain. We know that there are a number of clinical trials that are underway that explore the use of regenerative medicine and cell therapies to address these and many other conditions. A recent survey of our members indicated that nearly 1/2 have considered these therapies. We also learned that more than 80% would like to learn more about these therapies. We launched the NFL Alumni Regenerative Medicine and Cell Therapy Program in response to our members' interests and needs. The program is guided by an advisory committee of our nation's leaders and scientists in the field. We've held many programs for our members, including how these therapies address a range of conditions, including musculoskeletal conditions. Just last week, we hosted a program highlighting promising research on the use of these therapies for autism, GVHDs, cerebral palsy, and other children's conditions. Now, this is all in line with our mission of caring for our own, caring for children, and caring for the community. In addition to making these programs available to our members, we are publishing all of our resources on our website to support all patients. I'd like to thank the many prominent leaders in our field who help guide our work through our advisory committee. There are too many to thank individually, but you can see the list of members on our site, www.nflalumnihealth.org. I'd like to thank Kyle Richardson, Billy Davis, and Janet Marchabroda, who are leading this programmatic work and making this program possible. I'd like to extend a special thanks to the Marcus Foundation and Sanford Health, who are helping to support the work of our organization in this area. Thank you. Finally, many heartfelt thanks to you, Bernie Siegel, and to the members of your board for your tremendous leadership at the Regenerative Medicine Foundation and for presenting this award to us. We are honored. Thank you.
Congratulations to NFL Alumni Health for being the recipient of the 2021 Stem Cell and Regenerative Medicine Action Award from the Regenerative Medicine Foundation. It signifies your leadership on advancing regenerative medicine and cell therapies for former NFL players, coaches, and all Americans. You know, as a coach, I've seen the toll that the game can take on NFL players both during and after their careers. A couple of years ago, I accompanied 20 retired NFL players on a trip to Israel. This venture required a lot of walking because of the narrow cobblestone streets were not conducive to vehicular traffic. Many of these young men, some half my age, struggled due to the injuries they had incurred during their playing careers. Thus, it prompted me to become an advisory board member at the Wake Forest Institute of Regenerative Medicine. NFL Alumni Health is helping its members tackle these issues by providing informational resources on how regenerative medicine and cell therapies can help address issues common to current and former athletes, such as injuries of the knee, hip, and shoulder, and many other maladies and serious health conditions. NFL Alumni Health's program is bringing together nationally recognized experts and scientists in the field to advise former players on the clinical trials available and questions they should be asking before seeking treatment. Again, congratulations to NFL alumni for this well-deserved award.
The advances in gene editing are a game changer. Our Pathfinder Award goes to Dr. Feng Zhang. Feng is a molecular biologist who has developed novel molecular techniques for studying the brain. He pioneered the development of CRISPR-Cas9 as a genome editing tool and has substantially expanded the use of CRISPR tools. One day, CRISPR might be harnessed to treat and possibly cure debilitating medical conditions such as sickle cell anemia, Duchenne muscular dystrophy, Huntington's disease, HIV, and cancers. Feng is currently a core institute member of the Broad Institute of MIT and Harvard, as well as an investigator at the McGovern Institute for Brain Research at MIT. We have two individuals, advocates, that will describe the importance of Dr. Zhang's research. Both have been honored by the Regenerative Medicine Foundation. In 2012, we honored Susan Solomon and the New York Stem Cell Foundation. Susan is now the founder and the chief executive officer of the New York Stem Cell Foundation Research Institute, which is the world's leading independent nonprofit research institute dedicated to translating cutting-edge stem cell research into clinical breakthroughs and cures for patients. Located in Manhattan, it is absolutely an astonishing feat of advocacy that foundation has created and is doing independent, world-class research. Also, we're going to hear from Frances Saldaña. Frances and her family has been afflicted terribly by Huntington's disease. We honored the HD grassroots community with an inspiration award at the World Stem Cell Summit in San Antonio in 2014. I had met Frances in 2011 in Pasadena at the summit, and it was there I learned about the affliction of Huntington's disease and the devastating toll it takes on those that perish and those left behind to deal with this. Gene editing provides hope.
I'm Susan Solomon, the CEO of the New York Stem Cell Foundation Research Institute, and it is a special pleasure to be here and say a word about Feng Zhang and what he has meant not just for those of us in the stem cell community, but for every one of us on this planet. For his work has had an extraordinary impact, the kind of impact that only a handful of scientists can lay claim to. From his seminal role in creating the technology of CRISPR gene editing in human cells to his numerous adaptations of this technology, Feng has changed the world. But we're honoring Feng not only for his achievements as a scientist, but for his attitude about science. Science all too often feels divided between those who favor basic research and those who think in terms of practical applications. But Feng's work transcends this false division. He is constantly developing new ideas and then connecting them to real-world applications. He does not want to be on one side of this divide or the other. He wants to show us how wrong and unnecessary this split really is in the first place. In this sense, Feng represents the very best of science. He goes where his curiosity takes him, and his curiosity is a magnificent engine driving his brilliant work, pushing him and his laboratory in dozens of projects simultaneously. Last year, when the severity of the pandemic became clear, Feng immediately pivoted his technologies using the groundbreaking CRISPR gene editing to develop a faster, cheaper test for COVID-19 And by May of 2020, he had a prototype that cost $6 per test. He also developed a self-reporting app called How We Feel that tracks changes in the spread of COVID-19. We at the New York Stem Cell Foundation Research Institute have been privileged to have known Feng for most of his career. He was one of our early Naisif Robertson innovators, and when his 5-year fellowship ended, he became one of our most engaged alumni. His mentorship and involvement with our new grantees, events, and scientific retreats have set the standard for community building. His novel approaches and enthusiasm remain the high bar for entrepreneurship at the highest levels. He communicates about science with the clarity of a natural teacher, and he always answers emails a few hours after I send them, despite the demands of his lab and the young family to whom he is a devoted father. Walter Isaacson, in his recent best-selling book about gene editing, describes Feng multiple times with the word gracious. And Feng is all that this word implies: caring, engaged, committed, knowing, and kind. He is truly in a category all his own. So Feng, I speak on behalf of all of us here when I say that it is an honor and a privilege to recognize your significant contributions with the Pathfinder Award. I'm so happy to call you a colleague and a friend. Congratulations.
Hi, Dr. Zhang. Congratulations on being named the recipient of this year's Distinguished Stem Cell and Regenerative Medicine Action Award. Your brilliant work as a pioneer in molecular biology and your hope of improving human health could not be more meaningful to me. This is because I have lost my mother-in-law, the father of my children, and all 3 of my children to Huntington's disease. After having lived through 3 generations of genetic diseases, the story doesn't end there, and neither does my hope for a cure. The vital role that you have played in the development of CRISPR-Cas systems may one day lead to a treatment that will save so many lives throughout the world. Like my own family, these are families who are anxiously awaiting a treatment that will free them from a disease that is passed on from one generation to the next. A world free of Huntington's disease in my own lifetime would be my greatest wish. My children never lost hope for a cure, and your continued search for treatments for neurological diseases such as HD allows me to keep their spirit of hope alive. So on behalf of Huntington's disease families from all over the world, I feel honored for the opportunity to thank you and to congratulate you for your brilliant work. Thank you and congratulations.
I would like to thank the Regenerative Medicine Foundation for this tremendous honor. This recognition is not just for me, but for my entire team, my collaborators, mentors, teachers, my parents, and my family. I want to take this opportunity to say a couple things about teachers and mentors, especially during primary and secondary education. I was very fortunate to move to the United States 28 years ago with my parents, and I'm grateful to all of the teachers who have inspired and supported my learning and development. From my English as a second language teacher, Marilyn Reece, who taught me English and American culture, to my science teacher, Ed Pilkington, who showed me the movie Jurassic Park and inspired me with exciting advances in biology through simple but memorable experiences, such as extracting DNA from strawberries. And my first research mentor, Dr. John Levy at Iowa Human Gene Therapy Research Institute, who kept me captivated with his passion for gene therapy and the destruction of cancer cells. And also my graduate school mentor, Carl Deiserath, who not only taught me how to be a scientist, but also how to be a catalytic member of the scientific community through open sharing of knowledge and technologies. There are numerous other mentors and colleagues I am indebted to, and that list is too long for me to recite today. But most importantly, I'm grateful to my parents, my wife, for their mentorship and support. They have instilled in me the value of striving for excellence and generosity. They have always emphasized to me the importance to always do my best and to create things that can make the world a better place, and that has been a guiding principle for me all along. Finally, I want to say how exciting it is to be a biotechnologist today. Our understanding of biology is growing at an ever-increasing rate, and our capabilities for illuminating biological processes and turning those understandings into new therapeutics is unprecedented. I'm incredibly inspired by this enormous opportunity, and I am looking forward to working with my team and continuing to collaborate with researchers around the world to advance human health.
To advance the field of stem cell research and regenerative medicine, public education is a necessity. Our education award goes to the Global Immunization Action Network team, GIANT. GIANT works to improve global public health outcomes by combating vaccine hesitancy through effective, sensitive, science-based communication and education. Throughout the COVID-19 pandemic, their extraordinary team has provided important, credible, and factual information for people and communities around the world to embrace immunization with trust and confidence. Without health literacy, public health will fail. GIANT presents a novel and timely topic to the World Stem Cell Summit: health literacy, stem cell science, vaccine development, and confidence in the age of the COVID pandemic and infodemic. Forged by one of our greatest advocates, Bill Remak, this organization spans the globe to educate communities on the importance of vaccines. And in this era of the COVID outbreak, I can think of no organization more worthwhile to achieve and have recognition at the World Stem Cell Summit. With opening comments about GIANT, I'm very honored to introduce the president of the University of San Francisco, Paul J. Fitzgerald.
Hello, my name is Paul Fitzgerald, and I am the president of the University of San Francisco. I am very pleased to add my words of congratulations and words of profound gratitude on the occasion of this honor being awarded to one of the most popular and effective preceptors for USF's School of Nursing and Health Professions, Mr. Bill Remak, president of the California Hepatitis C Task Force. Last year, the task force launched the Global Immunization Action Network, also known as GIANT, whose mission is to, quote, improve global public health outcomes by combating vaccine hesitancy through effective, sensitive, science-based communication and education, unquote. Bill and his team have been recognized by the Regenerative Medicine Foundation for this important and very timely work. Bill has been an exceptional preceptor in our Masters in Public Health and Doctor of Nursing Practice programs since 2015, mentoring USF grad students who have gone on to follow Bill's model of a scientist in service of humanity. When he told us about GIANT's launch, he wrote that, quote, this project would not have been possible without the help of USF interns and others who have put in countless hours and dedicated themselves to this effort, unquote. Bill himself has faced serious health challenges personally: cancer, diabetes, and a double liver transplant. These adversities awakened and strengthened in him a passion for public service, for inspiring leadership, and a deep mentoring that wonderfully aligns with the Jesuit model of cura personalis, care for the whole person. At Jesuit universities around the world and for 450 years, we teach a commitment among our students to understand that a human person is a body, mind, and spirit, a member of a community and of a culture, past, present, and future. Bill's teaching style wonderfully meshes with USF's Ignatian pedagogy. Ignatian, a reference to St. Ignatius of Loyola, the founder of the Jesuits. For these last 5 centuries, our schools have integrated the study of the sciences with that of mathematics, literature, history, art, and all the other disciplines by which we come not only to understand the world, but also to care deeply about it and to form the world in the best and healthiest possible direction. For the past 7 years, Bill has been inspiring USF students to learn the best science, the best public policy, and the best philosophical justifications for those policies, and also to reflect on why these students should become exemplary healthcare professionals who care for persons, communities, and all of humanity with courage and conviction. Bill Remak, congratulations on this recognition of your many, many contributions, and thank you for the many more to come. God bless.
Ladies and gentlemen, honored guests, and esteemed scientists, fellow remarkable awardees, attendees of the 2021 World Stem Cell Summit around the world. Our desire to launch an initiative to respond to the needs of educating the world to regain the trust and confidence in the incredible benefits of science and wellness advantages of vaccines was gradually building in recent years, but our Global Immunization Action Network team took off like a rocket due to the urgency to control the pandemic over a year ago. We quickly learned that the imperative for success and creating that capacity had real meaning to our collective survival. All scientists share this dilemma too. And for that reason, we dedicate our education award to the heroes of the past, present, and future in science and medicine everywhere. Because without all of you running into the explosive fires of diseases in the world, many of us here watching this and our children and loved ones would not be here today. On behalf of our humble but astounding giant team, an incredibly dedicated and compassionate, prestigious group of men and women in over 35 countries, the brilliance of our amazing interns, our many partner organizations globally, I stand here knowing so much work is ahead of us to convey the principles of science in energizing the world to become literate, and as we grow in fostering understanding of our motivation to bring miracles to healthcare throughout society for so many conditions that cause great suffering, despite the enormous avalanche of so much wrong information we all face from non-credible sources. I would like to thank Bernie Siegel, Executive Director of the Regenerative Medicine Foundation and founder and chair of the World Stem Cell Summit, his prestigious board of directors for honoring our team with the award for education for 2021. Knowledge is power, and as we learn and apply this incredible developing science of infodemiology to address health literacy, the importance of education and the continuity of learning never stops, because this will indeed change the world for the better. Now, with great honor and appreciation, let me introduce our Director General, head of the Global Immunization Action Network team, a wonderful leader, humanitarian, and educator, Dr. Terri A. Lewis.
Thank you, Bill. Esteemed colleagues and hosts, our fellow award recipients and attendees of the 2021 World Stem Cell Summit. When circumstances call us to action, we must respond. I'm honored to accept this award on behalf of the Global Immunization Action Network team, or GIANT. In the social media environment that unites us, alternative facts and misinformation travel like a brush fire, consuming truth, creating fear, and misinformation that destroys trust in established healthcare practices at a time when collaboration, accuracy, and speed are of paramount importance to quell the spread of infectious disease of all types. Under the sponsorship of the California Hepatitis C Task Force, Giant was formed to address one of the most pressing needs of this global pandemic, that of accurate information about the safety of vaccines and related innovations, made consistently available to affected populations around the world through frontline health workers such as yourselves. COVID-19 has consumed the world's attention. We're horrified by the impact of the virus on local communities and remote regions of the world. We marvel at the speedy development of new vaccine technologies. While COVID is our most recent concern, it is not our only concern. Opportunists have also seized this moment to promote a fear of science, health practices, and each other. The deployment of old and new vaccines within this pandemic climate has proven to be a challenging task for all of us, made more difficult by messages designed to create mistrust and fear of our fellow man, our various international health partners, political institutions, and more. The battle for our healthy planet requires that we deliver consistently accurate information as trustworthy messengers in order to instill confidence in the tools of health literacy. Giant has responded to these challenges by reaching across political and cultural boundaries to existing health networks. We have assembled a team of local health leadership across government, private industry, NGOs, and local community systems to build tools for accurate messaging delivered through culturally fair strategies and trusted messengers. We're a very young organization, but our goals are very big. We continue to seek partnerships from all corners of the world, putting aside our differences to support each other, irrespective of political differences. With our partners in Europe, the Middle East, the African continent, North and South America, and Asia, we are examining our shared obstacles, developing collaborative learning tools to combat the infodemic of inaccurate health information that spreads distrust in health systems, health workers, and health practices. We gratefully accept this Action Award for Education from the Regenerative Medicine Foundation, and we invite you to follow our progress. Thank you.
As the world knows, in 2020, on the ballot was Proposition 14 in California. It passed, and as a result of that, the groundbreaking work of the California Institute for Regenerative Medicine, a state agency, will continue. Proposition 14 is bringing an additional $5.5 billion to this critical organization. It's accelerating stem cell research and translating it into potential cures. Okay, who was behind Prop 14? Who would have the audacity to put this on the ballot, especially in 2004, Prop 71 created the original $3 billion in state funding. They said it could never be done, but the Klein family of Bob Klein and Danielle Klein and Bob's son, Rob Klein, worked tirelessly to conceptualize Proposition 14, procure the leadership, secure the ballot signatures, place this on the ballot, and passed it. Monumental advocacy. And it's for that reason the Leadership and Advocacy Award in 2021 goes to the Klein family. They provided the essential leadership. Bob and Danielle served as co-chairs, and Rob served as president of the campaign. They got the job done when everyone said it couldn't be done, but there was usually a hesitancy. If anyone was going to get it done, it was going to be the Klein family. We are honored to present Honorable Speaker of the United States House of Representatives, Nancy Pelosi, Alzheimer's and stem cell advocates Seth Rogen and Lauren Rogen, and Stemmy the Stem Cell.
As Speaker of the House, I'm honored to extend congratulations to Bob, Danielle, and Rob for this hard-earned and richly deserved leadership award from the Regenerative Medicine Foundation. For the last 2 decades, you have harnessed your powerful voices and brilliant minds to pioneer stem cell research in California, and now I'm pleased to see Rob's new generation of leadership in this important mission acknowledged. Indeed, it was your hard work on Prop 71 that launched the vital California Institute for Regenerative Medicine and secured billions in new funding with Prop 14 on the ballot last November, a truly remarkable feat. And under your visionary leadership, the Institute has been on the cutting edge of stem cell research for nearly 20 years, pushing the limits of science toward new treatments and cures. That you and Danielle have been honored, and Rob too, with this prestigious award is a testament to your lasting impact. Your work will improve the lives of countless patients in California, across the country, and around the world. And I would be remiss if I did not mention Bob's fierce advocacy on behalf of California's families. In the 1970s, were you in school? What was that? He successfully lobbied the state legislature to establish the California Housing Finance Agency, which has helped finance the construction of affordable housing all across our state. Bob, Danielle, and Rob, I cannot wait to see what you do next to advance the public good. Congratulations again, and best wishes for a wonderful celebration. Thank you.
Hi, I'm Seth Rogen.
And I'm Lauren Miller Rogen. I've been the Alzheimer's patient advocate on the board of the California Institute of Regenerative Medicine since 2014, and in that time I've gotten a front row seat to the incredible and literally life-changing work that CIRM has done.
And I've heard about it all when she comes home from the meetings. And yes, we are both overwhelmed by it all, but we are able to understand that because of the tremendous work Bob, Danielle, and Rob have done, the state of California has become a leader in groundbreaking science.
The Kleins pulled off a truly remarkable feat of patient advocacy and public policy with the passage of Prop 14 to secure $5.5 billion for stem cell and related research that will make a difference for patients everywhere. And that was after they'd already done it with Prop 71 in 2004.
Prop 71 and CIRM have been central to the evolution of this field, which in a relatively short period of time for science, just 15 years, has arrived at a juncture at which we have hundreds of clinical trials happening nationally, more than 90 in California alone.
That means we are getting even closer to FDA-approved treatments and cures that we need for diseases that have been confounding us for generations.
As patient advocates ourselves who lost a beloved family member to one of these confounding diseases, we could not be prouder to honor Bob Klein along with Danielle and Rob tonight as they receive the 2021 Stem Cell and Regenerative Medicine Action Leadership Award.
Congratulations, Bob, Danielle, and Rob, from us, from our families.
From Stemmy the Stem Cell, that is me, and on behalf of the patients for whom you've made such an incredible difference.
Thank you.
Hi, I'm Stemmy the Stem Cell. I have the power to regenerate and repair the body. I have the potential to cure diseases and keep you healthy. Basically, I'm the tiniest yet mightiest superhero on the planet, possibly the entire galaxy. And when I'm teaming up with the California Institute for Regenerative Medicine to fund stem cell research and treatment development, I feel invincible. As long as Prop 14 brings me more funds. I've increased motor function for quadriplegics. I've helped blind people regain sight. I've helped type 1 diabetics make their own insulin. I cured the fatal bubble baby disease. Pretty incredible stuff, right? Well, there's more and it'll blow your socks off. CIRM funds important medical discoveries. Medical discoveries are the foundation of finding and making treatments and cures. CIRM funding helps bring life-saving treatments to the market. I don't want to brag, but I help cancer patients a lot. CIRM recognizes that students are our future, so they actively support our youngsters with grants and paid internships. Bringing the world's best minds together means exceptional results, so CIRM brings lots of grants to new faculty. CIRM is building a better world for all of us. 17 instrumental institutes, centers, and clinics were built with CIRM funding. Now that is impressive. SERM has a major positive impact on California's economy. Tens of thousands of jobs have been created and billions in economic stimulus generated. I am speechless, but I'm not. I'm going to keep talking. Can you believe SERM accomplished all of this in less than 14 years? Imagine what SERM could accomplish with just 10 more years of funding for stem cell research and treatment development. We could significantly increase the chances of finding cures and treatments for degenerative diseases. We can directly impact the future of your overall health. We can continue funding medical research. We can help discover a treatment or cure for devastating diseases like Alzheimer's, cancer, and Parkinson's. We will bring more economic prosperity and jobs to the state of California. Remember this November, vote yes on Prop 14 for the funding I need, so I can save the world and stuff. Thank you. I love you. Stemmy signing off to go treat a patient in need, saving the world one stem cell at a time. Visit yeson14.com for more mind-blowing information.
Thank you. I want to thank the organizations that are sponsoring this award on behalf of our family. Our family is a family of advocates, each coming to patient advocacy for medical research and therapies from a different, passionate commitment through another person who suffered, whether it's a member of our family or another family. I wanted to also thank the entire coalition, but we're going to break that up between members of our family. It's a monumental task to pass an initiative in California for $5.5 billion for stem cell research and genomic research and therapy development. It takes the civic society and the scientific society and the patient advocates, as well as the government of the state, coming together as a coalition. Specifically, though, I should call out that Senator Art Torres, a former state senator who's now vice chairman of the governing board of the state funding agency, committed 2 years of his life as an executive co-chair of this campaign. And the governor endorsed this initiative, the lieutenant governor endorsed it, Secretary of State Padilla, now a U.S. Senator, endorsed this initiative on the executive branch side, and on the federal level, Nancy Pelosi provided a powerful endorsement. It's a coalition backed by the government, but supported and driven by patient groups and universities, by independent institutes like the Salk Institute or the City of Hope. And tonight, in just a couple of minutes, we hope to thank some of those leading groups as examples of this tremendous coalition. But I would like to specifically focus on the fact that we owe all of this to the people of California, because the California voter is a visionary voter, a voter who is looking to change the world, to change the suffering that's been with us from chronic disease for centuries, for the millennia, to find a better vision for tomorrow. I entered this with a son suffering from type 1 diabetes that threatened his life every day. I entered this with a mother who had Alzheimer's. They've both passed away. But for our families who continue, for the future, for our children's children, we have a voter group in California that in the middle of a pandemic, when the economics of the future for their own family are threatened and the state's economy is threatened, they will come out in a historic number to vote and pass this initiative. This initiative passed with the greatest vote in numbers, 8.5 million yes votes in the history of any initiative in the United States of America. It is remarkable and a testament to the people of California, to the scientists who have driven this research and therapy development to the point we have 12 FDA breakthrough designations, to the point where we have phase 2 trials where we're demonstrating dramatically that children born without immune systems, that young men or women who are paralyzed by accidents, that older citizens who are blinded by age-related macular degeneration, or younger citizens that are blinded by genetic forms of blindness. We are, through the science led by California, through stem cell research and genomics, treating cancer, heart disease, diabetes in a way that mitigates this suffering and changes the future of medicine. So thank you, California, and thank you, as we will say today, through my wife and through my son, a great thanks to all of those who made this happen. My wife, who began way before I did with medical advocacy, and my son, Robert, who ran this campaign, all of its consultants, all of the consulting governmental relationships and civic relationships and communications. We have too many to thank today, but it will be a start, and we humbly accept this award on behalf of all of them. Thank you.
Good evening. As my husband mentioned, our family has had a long-standing commitment to scientific research. In fact, in the early 80s, I had the honor of working with Children's Hospital on funding bone marrow transplants. But science takes a long time. That said, all of us have lived through this recent pandemic, and we've also had the good fortune to witness the benefits of shared vision and scientific collaboration. California voters understood that. In 2004 and then again in 2020, California voters voted to accelerate scientific research and empower collaboration. We are living through a historic time. Tonight, our family is honored to be here with you because of your commitment to scientific research and because of the commitment of the California voters. On behalf of our family and on behalf of the patients and patient advocates everywhere, thank you for making medical miracles possible. I'd like to introduce you to a video made by Alicia Vaccaro. It is about her daughter Evie, and it actually demonstrates medical miracles. Thank you.
Evangelina was diagnosed at 6 weeks old with SCID, that stands for Severe Combined Immunodeficiency, and that means she had no immune system, and any illness, virus, bacteria, or fungus could potentially kill her. There was this new gene therapy trial at UCLA, and she started chemo, and they took out her stem cells, and they genetically modified those stem cells and put them back in her. And within 3 weeks of starting that process, a little bit before Christmas, Dr. Cohen at UCLA came and told us it's working. When you see your kid living, and this is the kid that you saw get the blood transfusions, get the chemo, and have this now functioning immune system is an amazing gift. Please vote yes on Proposition 14.
This was an especially challenging campaign due to the extraordinary nature of an election held during an unparalleled pandemic, which added complication and difficulty to nearly every element of the effort. COVID-19 made it extremely difficult just to gather the signatures necessary to qualify for the ballot. While we had many visionary donors, for which we are eternally grateful, funding was largely hard to come by due to an incredible economic unpredictability and a record-breaking political fundraising season. Many of the major news outlets had little bandwidth for in-depth analysis of, much less attention for, anything beyond COVID and an especially contentious election cycle at every level from state government to the presidency. There was an inability to travel and to canvass door to door. Traditional methods of engagement were groundbreakingly expensive, from TV to internet to common mailers, with media spending eclipsing $1 billion from initiatives alone in California. There was a nationally resounding focus on cutting budgets and enacting general austerity measures. We were able to triumph despite these challenges due to an unequaled coalition of hardworking and dedicated patient advocates. We cannot overstate the difference made by our supporters. driven by their vision and commitment for the fight to better treat and one day cure chronic disease and illness. We would like to begin by thanking Speaker Nancy Pelosi, Governor Gavin Newsom, Lieutenant Governor Eleni Kounalakis, State Senate President Tony Atkins, Mayors Garcetti, Liccardo, and Steinberg, and many others throughout the state, the University of California Board of Regents, and hundreds of other elected officials, community leaders, Nobel Prize winners, scientists, public figures, cultural groups, research and academic organizations, and chambers of commerce throughout the state. Our tireless campaign team, including Senator Art Torres, Melissa King, Mitra Husman, Anna Maybach, Jacqueline Hantkin, Don Reed, David Serrano-Sewell, and our friend and close ally, Dr. Larry Goldstein. Our talented and invaluable consultants, Winter and Mandabach, Fiona Hutton and Associates, Basque Digital Media, FM3 and Associates, James Harrison and Olson Remco, and many others that lent their professional expertise to helping ensure victory. The dedicated and indispensable staff at CIRM, without whom the agency could have never realized the immensely compelling successes that surpassed all expectations. The governing board of the agency, many of whom contributed significant amounts of their personal time in communicating the importance of continuing the research, and of course, the brilliant CIRM grantees doing groundbreaking research and developing novel therapies that are already saving lives. We would like to especially thank our Patient Advocacy Coalition, who lent us their time, access to their membership, and their hard-earned credibility, which helped earn us the trust and consequentially the support of the voters of the state of California. They include JDRF International, the American Association for Cancer Research, the American Diabetes Association, the Michael J. Fox Foundation for Parkinson's Research, Beyond Type 1, the International Society for Stem Cell Research, Research America, HFC for Alzheimer's Research, the Regenerative Medicine Foundation, and the over 100 other patient advocacy and medical research advocacy groups that help spread our message and convince voters of the value of continuing this critical research. It is this great coalition that made the victory possible during the most challenging initiative campaign season in state history, especially for a bond initiative. We are humbled and honored for this recognition and for this award, but those were the true heroes of the campaign, and we will be eternally grateful for the extraordinary efforts to give scientific research the support it needs to one day conquer chronic disease and illness. From all of us and patients and their families everywhere, thank you.
It gives me great pleasure to congratulate Dr. Joseph Vacanti for being a Regenerative Medicine Foundation honoree. Dr. Vacanti is a Holmes Professor of Surgery at Harvard Medical School, and he served as the Chief of the Department of Pediatric Surgery and Surgeon-in-Chief of the Mass General Hospital for Children. As an academic surgeon, Dr. Vacanti has been active in clinical innovation as well as basic research. He instituted the nation's first liver transplantation program specifically for the pediatric population. Dr. Vacanti has been working on the field of regenerative medicine since the 1980s. Over the last 20 years, Dr. Vacanti has studied creating complete vascular networks as part of implantable tissue engineered devices, which then allows the fabrication of large, complex living structures. To further the field of tissue engineering, Dr. Vacanti was a founding co-president of the Tissue Engineering Society, now the Tissue Engineering Regenerative Medicine International Society. He also was founding senior editor of the journal Tissue Engineering. Dr. Vacanti has authored over 300 original reports, written over 70 book chapters, and he has 83 patents or patents pending in the US, Canada, Europe, and Japan. He has received multiple awards, including the Thomas Sheen Award, presented by the New Jersey chapter of the American College of Surgeons, the James Bartlett Brown Award from the Society of Plastic and Reconstructive Surgery, and the Clemson Award from the Society for Biomaterials. In addition, he was elected in 2001 to the Institute of Medicine. In 2007, the Board of Directors of City Trusts, acting for the City of Philadelphia, awarded Dr. Vacanti the John Scott Medal. In 2009, he became the recipient of the American Surgical Association's prestigious Flance Carl Award. Dr. Vacanti became a 2011 Thomas Reuters Citation Laureate in the field of physiology or medicine. In 2013, the American Academy of Pediatrics Section of Surgery named Dr. Vacanti the recipient of the William Latt Medal. In June of 2015, Dr. Vacanti received the Jacobson Innovation Award from the American College of Surgeons. In 2017, Dr. Vacanti received a Lifetime Achievement Award from the American chapter of the Tissue Engineering and Regenerative Medicine International Society. And in 2018, he was elected to become president of the American Pediatric Surgical Association. Aside from all the accolades he has received from his peers, the most impressive aspect of Dr. Vacanti is his personal touch and mentorship ability. I personally benefited from this. It gives me great pleasure to personally thank Jay as a dear colleague and a friend, and as a visionary leader who helped to guide the field to where it is today. And on behalf of the Regenerative Medicine Foundation Board, to congratulate you for being recognized as the 2021 Stem Cell and Regenerative Medicine Lifetime Achievement Honoree.
I would like to thank the Board of Directors of the Regenerative Medicine Foundation for the honor of being selected to receive the Stem Cell and Regenerative Medicine Action Lifetime Achievement Award. And I would like to thank all of you for the privilege of speaking to you today. As you all know, any success in regenerative medicine requires the close collaboration of many disciplines in science and medicine, and close partnerships in academia, industry, and government. This World Stem Cell Summit represents those communities in a very real and vibrant way. In my brief remarks today, I would like to focus on one of the holy grails of regenerative medicine, the manufacture of whole vital organs on demand to solve the terrible donor organ shortage in transplantation. I will put it into the context of my personal quest over the past 36 years and then suggest a future direction. Before I begin, I would first like to acknowledge 3 individuals who have been essential to my professional development and efforts in this arena. Dr. Judah Folkman of Harvard, my mentor and teacher over 35 years. Professor Robert Langer of MIT, my friend and collaborator of over 44 years. And my brother Charles, over a 70-year period. At my core, I am a clinical surgeon. This is one of my patients with a fatal liver disease who could be saved only by liver transplantation. This is how I became acutely aware of the organ shortage in a very intimate way. In 1985, while working on ways to increase the number of donor livers for children by implanting pieces of larger organs which were trimmed to the proper size, we experimented with biodegradable polymers or plastics to seal the bleeding surface of the liver. As I studied the effects of healing under the microscope, it occurred to me that we might be able to use the polymers to deliver cells to patients in an organized way, a type of cell therapy. We had early success with this approach, but there was a huge problem. An adult human liver weighs over 3 pounds, and so to actually help a patient, many billions more of liver cells to make liver tissue would be necessary. There was a major design constraint to overcome, as you see depicted here. If these spheres represent spheres of cells Each cell needs oxygen to breathe and nutrients. Both are only delivered at the surface, and so as a mass of cells increases in size, the surface cannot keep up with the demand, since the mass of cells increases as the cube of the radius, but the surface only increases as the square of the radius. I struggled with this problem for months until the summer of 1986. How could we make the cells on the inside think that they were on the outside? And then, while sitting on a jetty on Cape Cod in the summer of 1986, pondering this dilemma, the answer was waving in front of me. All of nature in all multicellular organisms, both animal and plant, solves this problem using branching systems to nourish every living cell, no matter how large the structure. Nature breaks the surface into massive surface areas for exchange of nutrients and oxygen. In us, the vascular or blood vessel system acts in this way. Here is a vascular cast of a lung, showing the exquisite branching down to the smallest capillary channels, each of which is 1/10 the diameter of a human hair. Using these branching patterns as templates for the scaffold design, we rapidly produced living tissues of many different types. And of course, in 1997, a mouse with a living human ear on its back went viral from a BBC television show. The controversy surrounding this image propelled the new field of tissue engineering into the public consciousness. New work in stem cell biology led to the creation of the term regenerative medicine, and stem cells became an important foundation for tissue engineering approaches. We continued our work in trying to increase mass to create vital organs, and in 1998 began to build vascular channels within our tissue engineered devices using computational fluid dynamics to build models which duplicated the flow characteristics of the normal blood circulation. Here you can see the blood vessels in a normal human liver. Here you see a 3D printed pattern of blood vessels into and out of a device that also contains the liver and bile duct compartments. Here is a recent design showing the extreme precision we can now achieve in vascular channels using 3D printing technologies. I hope that this very quick summary of my involvement in this emerging field gives you a sense of its promise and potential impact in human health. We are still in the early phases of the science and engineering of regenerative medicine. I can compare it to the early days of rocket development. Here is Dr. Robert Goddard in 1926. This first liquid-propelled rocket flew for 2.5 seconds to a height of 41 feet and traveled 184 feet. Compare that to the Saturn V rocket, which flew men to the moon 43 years later. I will leave you with this image. It represents the talent and commitment of a diverse group of professionals in many fields, tackling the problems in our field at least as complex as rocket science. Thank you again for the award and the privilege of speaking to you today.